Many women in India are told only two options for a symptomatic fibroid: either remove the fibroid or remove the uterus. What if I told you that there exists a non surgical treatment that treats and shrinks this fibroid without surgery, without stitches, and without having to remove the uterus? In this video, I will be talking about the top 5 questions searched on Google by Indian women about fibroid treatment. Let's discuss the top 5 questions asked or searched in Google about fibroid treatment in India, and we'll answer each and every questions in detail later. So these are the top 5 questions. The best non-surgical treatment for fibroid: what is the cost of the treatment, can it be cured without surgery, and recurrence rates, how does it affect pregnancy and fertility, and the best hospitals and specialists for it. Let's see the first question: what are the best non-surgical treatments for fibroids? Traditionally, fibroids are treated by surgery, that is myomectomy, remove the fibroids, or hysterectomy, remove the uterus. The non-surgical treatment of treating the fibroids is uterine artery embolization, recommended by many international society as one of the alternative to surgery for fibroid treatment. Because these fibroids are blood supply and hormone dependent, the blood supply to these fibroids, just like an angiogram where a small catheter is accessed through the wrist or the leg and goes into these fibroids, because these fibroids are blood supply dependent and hormonal dependent. The blood supply to these fibroids are blocked and the fibroid shrink gradually over a period of months, and giving you good symptomatic relief and overall reduction in the size of the fibroid. No uterus removal, no major surgery, no cuts or stitches on the abdomen, and early return to the work, and has got a comparable quality of life compared to the surgical options. Let's look at the second question: how much does the fibroid treatment cost in India? This is a very important question in context to India. The fibroid treatment cost varies from city to city, hospital to hospital. Be it surgical or non-surgical treatment like myomectomy or a hysterectomy or a fibroid embolization, usually ranges plus or minus between a lakh. And the most important point is, when you compare the treatment cost in India compared to countries like US, UK, it's very fractional or a nominal cost. Let's look at the third question: can fibroids be cured without surgery? Yes, fibroids can shrink significantly without surgery using uterine artery embolization. Studies show that fibroids volume reduce 50 to 80% over a period of months. Then the symptomatic bleeding control rate is over 90%, and majority of them avoid hysterectomy. Let's look at the fourth question: do fibroids affect fertility and pregnancy? Yes, fibroids can cause infertility, miscarriages, pregnancy complications. But treatment improves symptoms and may improve fertility depending upon fibroid location. Although successful pregnancy outcomes have been reported post-uterine artery embolization, but it has got its own implications, so it is better to have a proper discussion between a gynecologist and interventional radiologist and the patient. Those who are specifically looking for the pregnancy, myomectomy is usually recommended compared to the uterine artery embolization. Let's look at the last question: which are the best hospital or specialist for fibroid treatment in India? This is one of the most common question where women ask. Instead of focusing on a specific hospital or a specific treatment, it is important to visit a center which has both the facilities, and you can discuss with both the gynecologist and the interventional radiologist and choose the treatment that best suits you. Many international recommendations or guidelines say that a patient should be aware of both surgical as well as non-surgical treatment before he consents for any particular procedure, because the best treatment is the one that is safe and most appropriate to one's individual condition.